So government has decided to stop COVID-19 contact tracing with immediate effect, except where infections are picked up in congregate settings like prisons and old age homes. The Health Department published revisions to contact tracing, quarantine and isolation protocols on Thursday night. For reaction on this, we're joined by the South African Medical Association Vice Chair, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, thank you very much for joining us. Your initial thought when you heard this?
Well, my initial thought was that we should have done this at least earlier, maybe in the second wave or third wave. I think we've taken time to consider this. That's my thought.
And in terms of, the way forward, I guess, the more we learn about the way this works, the more changes are naturally going to happen. What do you foresee some of the other measures that might change would be?
Well, I think we're still learning from this. We've never had a pandemic of this magnitude, at least this century. So I do think that there are a lot of things that we need to consider. For example, even the issue of testing. We know now that we only test those that are asymptomatic. That might be also because by the fact that the tests are too expensive, they are a barrier to testing. And if you have if you have people who cannot afford, then they cannot go for testing. I do think that would change where we can afford testing. Because we do know that even though we are not going to test the people who are symptomatic, but they are also spreading the condition, even though they are asymptomatic.
There's been some, people in society that have argued that perhaps since we know that the Omicron variant is not as deadly in terms of presenting symptoms but moves quite quickly, that perhaps we should just let it play itself out so people can build immunity. Is there something to be said about that?
Well, I do think that it could be very dangerous to do that because some people are they have underlying medical conditions. If we just let it go uncontrolled, we might put other people at risk. For example, there are people who are over 69 or over 70, who have underlying medical conditions, they have heart conditions, diabetes, all sorts of things, kidney failure. So if you just let it go, you are putting those people at risk and they might lose their lives. I do think that we need to exercise caution still, even though we know that this virus is a little bit mild. Its mildness depends on who it lends itself to. If it lends to a person who is vulnerable, that person may die.
Thank you very much for your thoughts this afternoon. South African Medical Association Vice Chair, Dr. Mvuyisi Mzukwa.